whenever there is injury to this part of the spine, this is known as cervical spine injury. Now this part of the spine normally has 7 vertebrae and has spinal cord passing through this region, which supplies current or sensations to the entire body below this area. Injury in this part can affect hands, legs, motion urine, or the entire body below the shoulder level. So whenever there is cervical spine injury, it should always be taken seriously. If you are suspecting a cervical cord injury, do visit your doctor. He will get an X-ray or MRI done, and based on that he will apply a specific scoring system for the cervical spine injury. With that, he can calculate and tell you whether the surgery is required or not, or how that injury should be handled. If surgery is required, it should be done as soon as possible so that the nerve has best possible chance of recovery. Now, normally whenever there is injury to this part of the spine, either it is a problem in the alignment of the spine, or there is a fracture or breakage in the bony part, or there is pressure on the nerve. Now, if there is pressure on the nerve, it can lead to tingling or numbness in the arms or in the legs, loss of motion or urine symptoms, or it can lead to frank paralysis also. So whenever there is cervical spine injury and surgery is required, it can be done through the front part or through the back part. It depends on what kind of injury it is. Normally when we do from the front, we take out the bone that is crushed or pressing the nerve. We take it out and we put a cage in place of it. This surgery is known as cervical corpectomy, cage insertion and fusion surgery. This is also known as stabilization surgery. So when this surgery is done, we remove the broken part of the bone that is pressing against the nerve. We make space for the nerve. We stabilize it using cage, and we use a plate to protect it or stabilize it. So this surgery normally is done from the front, and it has good results if done on time and patient is having incomplete injury of the spinal cord. So if you are suffering from spinal cord injury, don't delay it. Visit your doctor. He might ask for your X-ray or MRI, and whatever is the best possible treatment for you, he will recommend you. Thank you.